Good morning, everybody. Good morning, and thank you for joining us. I'm Marcie Roth, and I'm the Executive Director and CEO of the World Institute on Disability. And I am joined by three incredible women. We're going to have a great conversation today. Our topic is inclusive training and employment during humanitarian crises. Disaster risk reduction requires adaptive, inclusive, and resilient approaches, particularly when aiming to continue training and employment for persons with disabilities during humanitarian crises. We will have some Zero Project awardees, and we will be offering innovative approaches for achieving this, using a combination of tools, manuals, and unique coaching approaches. I will begin with a brief description of myself. I'm old, I'm white, I'm fat, I'm disabled, and I'm proud. And I'm wearing a black jacket and a multicolored top, and I have fabulous glasses that I can change every day. The glasses actually come off, so I can change them. I will allow my co-presenters to introduce themselves, and then I'll give some brief remarks. They will then speak, and then we're really looking forward to a good conversation with all of you. So I will first turn to Yuliia, who will introduce herself.
Hi everyone, my name is Yuliia Sachuk. I am co-founder and head of the Ukrainian organization of people with disabilities, women with disabilities-led organization Fight for Right. And today I'm wearing red blouse. I am white, not too old as Marcie, but I am trying to follow her example, and I have glasses. I'm visually impaired and also very proud to be a woman with disability.
Thank you, Yuliia. And then Nevgül.
Hi everyone. Welcome all of you to our session. My name is Nevgül Bilsel Safkan. I'm the General Manager of Sabancı Foundation from Turkey. Today I'm wearing a green jacket. I have black blues inside with my earrings and a necklace, choker. And I'm a white woman, age 50, around 50s. I think everyone is mentioning about the age. So. And white woman with brown hair on my shoulders almost, with green eyes. And I'm very, very proud again to be part of the Zero Project and to be able to share our experience in this session. Thank you.
Thank you very much, Nevgül. And Dima.
Yes, good morning, everyone. I'm Dima Giacaman from Palestine. I'm the Economic Empowerment Program Officer at QADER. Today, I'm wearing a dark blue suit with a white shirt and white shoes. I'm a white woman in my early 40s. I have tall brown hair with green eyes, and thank you.
Thank you very much to all of our fabulous panelists. This is Marcie speaking again. So first and foremost, let's take a quick look around the room. If we needed to evacuate right now, I see one door open. I do see signage with one door behind us, two doors behind the audience. So if we needed to evacuate, I would ask that everyone assist each other to be able to get to those doors, and then we would follow instructions out in the hallway to evacuate to the pre-appointed locations. So in 2001, I was working for the National Council on Independent Living in the US, which is an organization of many independent living centers. And during the horrific terrorist attacks in 2001, I had a phone call from some folks who were in New York City who were saying, we have some additional problems here. Not only the terrorist attacks, which is obviously horrific crisis, but we have many people who live in the area around Ground Zero, and they aren't able to get assistance to come in because the people who are providing assistance don't have the right identification. People who need accessible transportation can't get picked up. The list of issues that were unintended consequences of the first responders trying to control the environment was so significant. And I actually had a phone call from the White House asking me to come to help the president to make sure that people with disabilities were not being left behind. Little secret, I had been working in disability rights my whole career, and I already told you I'm old, so this has been a long time. I had never really thought about what happens for people with disabilities in disasters. I had never thought about it. This was in 2001, and I started to make stuff up. And the more I made stuff up, and the more I learned, and others learned, we started to build some understanding about what we needed to do. And what I took away from that, and what I will be taking away for the rest of my life, is not only how do we make sure not to leave anyone behind, but for those of us who have jobs, for those of us who have family members with disabilities, and for those of us who have jobs and disabilities, we need to be able to continue to do our work. The people that we work with are counting on us to be able to work. If we're in school or we're in training, we need to be able to continue like everybody else. And so what we're going to be talking about this morning is what that's beginning to look like in a variety of places. Because even though there has been progress in planning for disasters, crises, that planning has generally not included any focus on what happens for people with disabilities in the workplace and for people who have family members with disabilities when they themselves need to continue their work. So I'll give you an example of how this became particularly, really piqued my awareness. During Hurricane Harvey, which was a very significant hurricane in the United States in 2017, a woman who was a senior executive with a very large global oil company in Texas, also the mom of a child, 9 years old, who is autistic and who had a lot of support at home, in the community, at school. During the hurricane, their house was destroyed, the school was destroyed, and many of the people who provided support to her son were evacuating to very distant locations. So over the next few days and weeks, Many people were able to return to the community. Many were able to get their children back to school or back to childcare. And this mom, who's a senior executive with lots of money, lots of resources, she had no home. The school that her child was attending was no longer there. And the supports that they counted on a daily basis were not available. She was unable to go back to work for a very long time. Her issue was not access to resources, financial resources. Her issue was there was no plan for her son to go to school in a new location with new supports, and for them to have transportation for him to get to school and to be supported. So I share this story, and I used to tell this story a lot before the worst days of COVID. I used to tell this story a lot, and I would say, what would you do as a worker if your child suddenly couldn't go to school for days or weeks? And people would say, I'm not really going to worry about that, because the fact of the matter is my child will be able to go to school, the school will be there, the supports will be in place. And then there was COVID, and suddenly many people couldn't go to work, their children couldn't go to school. And so the argument that we needed to start thinking about what happens when we need a continuity of operations, and at the same time, those supports are no longer available. And so the World Institute on Disability has been working very hard to develop the kind of resources that make it possible for the workplace to be planning for workers with disabilities, and as well families with family members with disabilities. We want our employers to be able to continue their operations or to resume their operations. And those employers who are committed to employees with disabilities as a fundamental part of their operations must be able to count on those employees to show up even in a crisis situation. So today we're going to be listening to my colleagues talking about their experiences in a variety of very catastrophic circumstances. Each of them has a very important story to tell. We're going to start with Yuliia, and I know Yuliia's story pretty intimately, but I'm looking forward for you all to hear what she and her organization have done. Thank you. I disrupted the order.
Yeah, thank you very much. And I will share during my presentation situation which we have in Ukraine during the Russian full invasion, because before the Russian war we were usual, I would say, regular human rights organization of people with disabilities, and mostly we were doing our advocacy work. We support our movement, and we were not consider ourselves, and we didn't be humanitarian actors. But first of all, in Ukraine, we have 2.7 million people with disabilities in 2021, and now this number is growing because of many civilians and veterans with disabilities we have, and the last official data we have is about 3 million people with disabilities. We don't know how many of them are in Ukraine and how many of them are internally displaced or refugees in other countries, but because to collect data during the war is also very difficult. But we know that only 16% of them are in work market. So key challenges which we face during the war. We have war-driven economic downtown. We also have discrimination and stigma as usual. We have displacement. We have limited job opportunities and changes in our work market, and also we have exclusion and limited options for recovery because we have attacks every day and businesses, companies are suffering each day. So the supportive mechanism at the same time which we have CRPD ratified and all we are trying to follow all standards. Also, we have mandatory quota 4% of people with disabilities, and also newly developed requirement to adopt workplace for accessibility. And many of our enterprises use this quota, this mechanism during the last year, more than 1,000. And again, about impact, so increased number, I mentioned this, of people with disabilities and veterans with disabilities. And following to this, we have really big need to adapt our workplaces to also to provide training, retraining programs for people who receive disability during the war. We have lack of workforce and also in different areas because many of our people now defend in country. And also there is high need for support services and in humanitarian sphere what we see. Because again, people who need support in Ukraine, the number is really high. So about our impact and our work as organization of people with disabilities. Beginning from the first days of the war, and nobody of us was thinking about to be humanitarian actors and to provide emergency response. But from the first days of the war, we started to do this because in our team, we have people with disabilities. More than 40% of us are people with disabilities, and my responsibility as a leader, as a person who runs the organization, is to provide also not only to be leader in advocacy area, but also its responsibility about them as workers. And before the war, we created and developed by ourselves plans of evacuation for everyone, provided needed support, financial support, etc. And also we created plan how we would work if the war will start. Also we launched fundraising campaign, but again, responsibility was the main reason why we started our emergency work. Now we helped more than 35,000 people with disabilities in Ukraine, but in this number, it's very important. It's not general contribution of services or humanitarian support. It is about individualized support. It is about timely support, evacuations, legal support, psychosocial support. It's about also providing assistive technology. It's about evacuations from frontline areas. It's about temporary accommodations, and also it's about recovery process. We also provide alternative energy sources during energy cutting in Ukraine and a whole range of support. it is also important that all mechanisms which we have for now we built by ourselves, but with support of World Institute on Disability and other organizations. We follow now all standards of international humanitarian law in providing humanitarian support. And again, as I said before, most of our team members are people with disabilities. So we have people with disabilities in different areas. We have them as a drivers, we have them as a case managers, we have them as a, people who work on hotline. And also, what is very important, we have them on different management positions. So project managers, advocacy lead, and people who are planning humanitarian actions also are people with disabilities. Also, we mobilized international support for supporting Ukraine, and our case management system, again, we use a lot modern technologies. We use Airtable, we use ClickUp. During the war, we used, when the war started, Be My Eyes to help blind people to evacuate, to find a transport for evacuations. We use Zoom, for example, to provide psychosocial support or support of mental health for deaf people, because it's possible to communicate and use video calls. And about lessons which we learned. People with disabilities, not only objects in different emergency situations, but also we can be subjects, and we can provide support not only for people with disabilities. I remember first months of the war, and I remember when we one of the first organizations who started to provide medical evacuations. Thanks, by the way, for the Nippon Foundation and other international donors. And we received many requests from families and people without disabilities, and they were asking, why you are providing support only for people with disabilities? We also need this support, and all our support is needed for many people who are not with disability. As I mentioned, 41% of our team are people with disabilities, and for 46, this work is their first work in their life. They couldn't find work in open market. Also, we provide support with this slogan, from people with disabilities to people with disabilities, and we see that this is the most appropriate way to provide humanitarian support, because we don't need to understand people who require the support needs. We are not asking terrible questions about why do you need a wheelchair when person said that he or she lost wheelchair during the evacuation. And also about actions which we see we need in the future in this area. We need people with disabilities in staff of preparedness, responsible state authorities. We need people with disabilities, meaningful participation during all stages of such program, development, planning, realization, and also assessment. And also we see high need in requalification of people with disabilities, and many of them can be, again, first proficient emergency responders. Thank you.
Thank you, Yuliia. I had the opportunity to watch you all in that process of building your capacity, and it's been a real model for people across the globe. Thank you. And now, I guess I've switched the order, but Nevgül, you are in the middle, so you were going to go in the middle either way. So.
Thank you. Thank you, Marcie. Actually, when listening to you in your opening speech, you were underlining the importance of schooling during crisis, different type of crisis, which I will also mention in my speech. Then later on, I was listening to Yuliia, and you were saying that all of a sudden you found yourself in humanitarian type of support. Also, you were an advocacy organization, which we also experienced similarly during our crisis. So then I was thinking, it is so similar what we experience in different parts of the world with different types of crisis. So there are so many more things we learn from each other. Thank you that we are together. About my organization and our insight about the humanitarian crisis, I want to start with a few words about Sabancı Foundation from Turkey. We are the Zero Project member since 13 years. Zero Project established in year 2011, and Sabancı Foundation has been a member in 2013. And it has been many years, of course. What I can say is Zero Project Conference influences a lot and motivates us when we go back to our work, to our countries, to do more. It's a great guidance, what we all experience here. Our foundation is one of the largest foundations from Turkey. Our revised vision, as we are a 50 years organization now, we revised our vision, which became that we support social development for a more equitable and sustainable future. Our focus is Turkey, but of course our experience is now international, and we have so many colleagues from all around the world. Our organization had the disability rights and the disability focus since early days. Sabancı family has also disabled people in the family. I think in many stories we have this as a common driver, I would say. Today, about the humanitarian crisis from Turkey, I will give you examples in relation to some disasters, which was an earthquake disaster from recent years. It was year 2023, 6th of February. We really experienced a devastating earthquake covering 10 cities, affecting more than 13 million people. And it resulted in more than 50,000 deaths. And more than 3 million people were homeless. So it caused so many destruction. Many buildings collapsed. Those buildings included hospitals, housing apartments, culture centers, schools. So you can think of variety of buildings, 10 cities damaged severely. Of course, among the affected, the individuals with disabilities were disproportionately affected. Unfortunately, there were many amputees. So there were many barriers. It's not that it's disasters, but barriers are always there. But if it's times crisis, then the barriers are more complex and challenging. And people with disabilities face difficulties in accessing employment, education, and training. Yes. Today, I want to share our foundation commitment to foster inclusion and resilience during humanitarian crisis. We had 3 key focus. One of them was inclusive education for all. The second was employability of women with disabilities. And the third was collaboration during crisis. As I said, all inequalities were deeper. 1/3 of educational institutions were damaged. It's quite a big number. However, a recent study shows that there is a strong desire among individuals who are affected by the earthquake to engage in educational activities and to learn the new skills, despite all these difficult circumstances. I wanna mention a little more detail about the focus of inclusive education for all. When it was the earthquake happening, first of all, we started with humanitarian activities. In the company, we didn't even have a purchasing person, expert. So we didn't know how to purchase tents, how to purchase all the needed humanitarian equipment. But you find your way. You start with the humanitarian help in the first place, even though you don't have your experience. But after some time, you start giving your real support on the area where you have your experience, where you can really help the community to build further. And it was, for us, in our case, establishing schools. We established 4 schools in the most affected provinces of the earthquake region. And those schools had the necessary infrastructure, such as ramps, such as accessible restrooms for children with disabilities. And we didn't stop it. Even though it's 2 years now, this year, the 5th school is under construction. This time, it will be about special education vocational high school. This school will aim to bridge the gap between the education and the employment. The children will gain hands-on experience so that they are employed in specific sectors such as carpentering, such as textiles, culinary arts, or IT. As a second key focus, other than inclusive education, we also concentrated our efforts for the employability of disabled women. A current big impact program that we have, which is targeting young women between age 19 and 29, with the aim, with the objective of increasing their employability, reaching those women through trainings, mentoring. We managed to reach 6,000 women. And out of 6,000 women, 800 are employed. On the disability side, of course, you need more focus, more care to create proper jobs for the women with disabilities. Because a recent study with 1,000 women with disabilities show that nearly half could not continue their education at the level they wish. And among those unable to continue the education, only 16% are employed. I have seen a similar percentage statistics in your presentation. I don't know how come that we have both 16 for the employment ratio. Is it a coincidence, or something else, I don't know. All right, so what we have learned further is the collaboration during crisis. So we were a member to a disaster platform, so-called disaster platform, with 65 NGOs together. And this network helped to reduce the impact through solidarity and cooperation. As we have seen during the crisis, how disadvantaged groups, particularly the ones with the disabilities, were disproportionately affected, we invited disability organizations to join the platform, to learn together, and to prepare for the other disasters together. So, as a result, I can say briefly there are two key learnings. One is that philanthropy can be a catalyst. Strategic philanthropy especially supports both immediate and the long-term system changes. How do we do it in strategic philanthropy? By engaging the civil society, the private sector, the local communities, and so that we ensure a sustainable social program and approach. The second learning is about how philanthropy can provide flexibility and adaptability in the times of crisis. So we have learned that it's important swiftly adjusting to the needs, because what we need is an effective response at the end, especially for the vulnerable groups. So I want to say that inclusion is not an option, but a necessity. Thank you.
Thank you so much. Your foundation has been such an incredible model, and I hope that others are paying careful attention and will do all they can to follow the model that you all have established. There's a huge need. Yeah, thank you. And Dima, looking forward to hearing from you.
Yes, good morning again. I'm Dima. It's a privilege to be here today representing QADER for Community Development. Today, I'm excited to share with you a critical issue, QADER's experience in the inclusion of persons with disabilities during a crisis in the Palestinian labor market. Today, I will walk you through QADER's approach to fostering economic inclusion in Palestine, a region where PWDs face significant barriers to employment, worsened by ongoing conflict and instability. Our work is grounded by the human rights-based approach, ensuring that persons with disabilities are contributors to the society. QADER is a Palestinian NGO established in 2008, specializing in disability rights, protection, and inclusion. Our vision is clear. We want persons with disability to enjoy full citizenship and actively contribute to a society that respects diversity free from discrimination, violence, and gender inequality. Our interventions are driven by innovation and evidence. We use research and reliable data to design our programs that are impactful and sustainable. Our approach focuses on two key areas. First, empowering persons with disabilities to overcome discrimination and marginalization. And second, influencing policies and institutions to align with disability inclusion and the global leave no one behind principle. Unfortunately, the reality of people with disabilities in Palestine is challenging. The overall unemployment rate in Palestine is 35%, but persons with disability situation is even worse. For instance, only 2% of women with disabilities participate in the labor market. The humanitarian crisis in Gaza is further worsening the situation. After 1 year of ongoing conflict, around 100,000 Palestinians are expected to develop long-term disabilities. These individuals will require urgent rehabilitation, assistive devices, and economic empowerment support. These statistics highlight the urgency of our work. At QADER, we have a main program, the Economic Empowerment Program. The Economic Empowerment Program goal is to promote labor market inclusion of youth and women with disabilities through the Entrepreneurship and Skills Development Center, QHub, which I will go through and discuss throughout my presentation. Now I will talk about QADER's approach to economic empowerment. At QADER, we employ a twin-track approach to economic empowerment, which focuses both on the person with disability and their surrounding. For persons with disability, we provide psychosocial support to them and their families and career counseling in order to enhance their employability skills to foster their inclusion in the labor market. For employers and the broader community, we advocate for the rights of persons with disability to decent work, assesses the inclusiveness of the workplace, and support employers in making necessary accommodations to become more accessible. We also establish social businesses that financially support disability community-based centers while creating accessible training spaces for persons with disability, particularly those with intellectual disabilities. QADER structures all its interventions and services within the Economic Empowerment and Entrepreneurship Skills Development Center, the QHub, that was established in 2021. It's the first of its kind in Palestine, dedicated to providing a model designed to enhance the employability of persons with disability. Based on the career counseling of the participants with disability at the program, participants are referred in one of the tracks of the QHub. First of all, the Technical and Vocational Education and Training, the TVET. Persons with disabilities are enrolled in certified training centers to develop their skills and for the labor market. The second track, we have the Life Skills and Job Readiness track. At this track, participants receive intensive training on the 21st century skills, followed by a paid 3-month internship at employer's workplace to gain hands-on experience. And finally, the entrepreneurship track, persons with disabilities interested in self-employment receive business training and business planning, and then they are supported with financial support in order to start up or develop their small business. They are then followed by on-the-job coaching to sustain their businesses. This is the 3 hubs the 3 tracks that I mentioned before. In Palestine, persons with disabilities face additional barriers during the crisis, such as mobility restrictions, economic instability, and limited access to resources. To adapt, QADER implemented a range of emergency-focused interventions, such as the psychosocial intervention that we provide to participants with disabilities and their families. We used a mixed training approach combining virtual and in-person sessions to overcome movement restrictions. We network with key stakeholders to expand our outreach in remote and marginalized areas. We relocate internship and training opportunities of persons with disabilities to their localities so as to minimize travel challenges. And lately, in 2024, we launched two initiative solutions. The first of all, QADER platform for economic empowerment of PWDs that maybe it's, I don't know if you can scan it from this barcode in order to see the platform, to go through it. This is a digital platform connecting persons with disabilities with job opportunities, training programs, and financial resources. You also can go to the platform through qd@qader.org. And also, we launched a business helpline offering immediate economic empowerment support, consultation, and guidance for persons with disabilities looking to join the labor market. Through our work for the last 2 years, we managed to refer persons with disabilities to job opportunities. 23% of our participants have a permanent job, and 40 persons started their small business. To illustrate the impact of our work, let me share with you Noor's story. Noor is a 27 years old woman from Hebron with a full hearing disability. She holds a BA in special education. Despite her having a certificate and a BA degree, she faced societal bullying. But with the support of her family, she refused to let these challenges define her future. She joined QADER's Economic Empowerment Program, where she joined the entrepreneurship track and received business training and support to expand her small kindergarten. Through mentorship and financial assistance from QADER, she turned her dream into a sustainable business. Today, Noor is a confident entrepreneur and a role model in her community. Her story demonstrates how economic empowerment can change lives. And finally, the path to economic inclusion for persons with disability is filled with challenges, but we know that with the right policies, programs, and commitment, change is possible. Together, we can create a world where no one is left behind, and thank you.
Wow, 3 great examples of being able to promote employment of people with disabilities in the most complex circumstances in the world. We know that if these 3 organizations can make the achievements that we're hearing about here, organizations that have not yet faced a crisis should certainly be able to be as successful. And I would suggest that the lessons that we can all take away from these organizations is that all of us need to be adequately prepared to serve people in the most challenging circumstances. We have about 5 minutes for questions, so I will open it up to the audience, and if anyone wants to raise their hand or indicate that they have a question, we'd be happy to have someone answer it. Yes, please.
Thank you so much. It was great presentation from all of you. I was wondering if the education system and that you have developed, especially in Turkey and Palestine, can be used more of online platform especially in Middle East, we never run out of the crisis. For example, in Afghanistan, there are women who like to be educated, but there is no physical place, or in Palestine, there is actually no access to schools. So maybe we can develop a full online platform for education of all years for children. I was wondering how close this can be achieved. Thank you.
Thank you for that question.
In Turkey, the National Ministry of Education has the online platforms. Actually, they did exist, but as many countries, I believe, during COVID time, we all realized that they need better technologies in terms of accessing them faster, better navigation, and which are developed. So currently, the online systems are available when needed.
In Palestine, we didn't have like a national platform for education. We have only just for each school alone. They have the school classes through Zoom, but we face difficulties through connections because marginalized area didn't have that much technology, so not all students have accessible to schooling and to the classes.
I can add from Ukrainian perspective, during the COVID, maybe you know, we are leaders in digitalization. So our authorities developed platform for online education for all children and all ages, and we helped them to make this online platform totally accessible with all lessons, with sign language, audio description, and easy format. So you can find online, and maybe it will be an example.
Thank you to all three of you, and clearly these are examples of educating the whole community under the most difficult of circumstances. So no excuse for anyone else in a less complicated situation. And it looks like we are now out of time. I wish we had time for more discussion. We will certainly all be available and would welcome the opportunity to continue this dialogue. We must find ways for employers and educators to be better prepared before the next crisis, and look very much forward to the Zero Conference 2026, where the opportunity to discuss crisis in greater detail will be one we can all have. Thanks to Zero, and thanks to all of you for your time and your interest.